Today's drug is Loratadine, brand names Claritin and Allergic. The therapeutic category is that it's an antihistamine, it's an H1 receptor antagonist, it's also known as a second-generation antihistamine. The main indications are for allergic rhinitis or conjunctivitis. Loratadine treats both nasal and non-nasal symptoms caused by seasonal allergies. The next indication is for urticaria. Loratadine treats itching caused by hives. Dosage form and strength. The medication comes in a 10 mg capsule. It also comes in a 5 mg per 5 milliliter solution, as well as a syrup that also comes in that 5 mg per 5 milliliter concentration. There is also a tablet that comes in a 10 mg strength, a chewable tablet that comes in a 5 mg strength, and a disintegrating tablet that comes in a 5 mg and 10 mg strength. Dosing by indication. Dosing for allergic rhinitis or conjunctivitis in adults. Initiate 10 mg by mouth every day or 5 mg by mouth twice daily for a max dose of 10 mg per 24 hours. Dosing for acute and chronic urticaria in adults. Initiate 10 mg by mouth every day and may increase to 10 mg by mouth twice daily if uncontrolled at lower dosing. Note that it's important that the higher dose of 10 mg twice daily has limited data supporting those benefits. Dosing for allergic symptoms and hay fever in pediatrics. In children greater than or equal to 2 to less than 6 years of age for the liquid or chewable tablet, initiate 5 mg by mouth every day. For children greater than or equal to 6 years of age up to adolescence, for the liquid, capsule, tablet, and chewable tablet, as well as the disintegrating tablet, 5 mg by mouth twice daily or 10 mg by mouth every day. Dosing for urticaria in pediatrics. For children greater than or equal to 2 up to less than 6 years of age, for the liquid and chewable tablet, 5 mg by mouth every day. For children greater than or equal to 6 years of age up to adolescence, initiate 10 mg by mouth every day. Mechanism of action and pharmacology. The mechanism of action is Loratadine is a selective H1 receptor antagonist. It is a long-acting tricyclic antihistamine. The absorption is rapid. The distribution is about 119 liters per kilogram and selectively binds to the H1 receptor with no entry into the CNS. Loratadine is hepatically metabolized via the CYP2D6 and 3A4 pathway to an active metabolite. The medication is excreted 40% in the urine and 40% in feces. The onset of action is between 1 to 3 hours, with the peak effect occurring around 8 to 12 hours. The time to peak for Loratadine is around 1.3 hours, while the active metabolite is around 2.3 hours. The duration of action is around 24 hours. Regarding the half-life elimination for Loratadine, it's around 8.4 hours, with the variability lying between 3 to 20 hours as Loratadine and 28 hours, with the variability lying between 8.8 and 92 hours. Hepatic impairment does extend elimination to around 24 hours as Loratadine and up to about 37 hours when it's the active metabolite. Regarding protein binding, it is between 97 and 99% as Loratadine and 73 to 76% when it's the active form. Special populations and considerations. Dose adjustments should be considered in elderly patients, those with renal and hepatic impairment due to the concentration in blood plasma being increased. Loratadine is considered safe in pregnancy while treating allergic rhinitis or urticaria, but only when a second-generation antihistamine is needed and when the lowest effective dose is being used. Side effects. Generally limited side effect profile, but patients may experience headaches, sedation, drowsiness, fatigue, and abdominal distress. Drug interactions. Do not use loratadine with desloratadine or other similar medications. Loratadine may increase CNS depressant effects of alcohol and other medications that affect the central nervous system. Loratadine may increase anticholinergic effects of anticholinergic agents such as dicyclamine and amantadine. Monitoring parameters. Of course, one can monitor the LFTs and renal function, but it is also wise to monitor the level of sedation if that is being noticed in the patient. Patient counseling information. Loratadine is used to treat allergy signs and symptoms or to treat hives. Can be taken with or without regard to food and meals. There are generally limited side effects, but some patients do experience fatigue and headache.